Indian pharmacist, or you can say Asian pharmacist. So before we start, I would like to say a few things that this is Elite Expertise. This is an Australia-based institution which train for Australia, New Zealand, Canada, Ireland, and DHA exam for Dubai. And we do not provide any kind of migration services. We are not an migration agent, and we are only a teaching institute. We can guide you free of cost regarding the migration processes, but we are not an migration agent. Please keep this thing in your mind before starting this webinar. And if your question is, are you providing some migration services? So our answer is no, we are not providing any kind of migration services. We do provide guidance regarding the migrations pathway, options available so as to migrate to these countries. So I would like to start from a presentation, and I would like to share my screen first. Is it visible to you? Can anyone unmute?
Yes,
And
Rakesh, bhai, it's visible. And to everyone who has joined, I want to say one thing that you guys are free to mention your queries in the chat box. Whichever query you have, you can mention in the chat box. And in the end, Rakesh bhai and Kripa ma'am will take those queries and answer your questions. Yes, you can carry on.
so, as we all know, this webinar is regarding global pharmacist licensing exams and their eligibility and benefits and visa types. We are going to discuss in this webinar. Am I audible to all, and my screen is completely visible? Is it clear, Ashutosh?
Yes, to me it's visible. To all, I would like to ask you guys, you can mention in the chat box, yes, people are mentioning. It's
Okay.
visible and you are
Thank you.
very much audible.
Thank you. Thank you. Oh, so this is a basic thing, because the information we are going to share with you is taken from the official website of concerned websites, and but the information may change from time to time. So please refer to the right information with the right website, because sometimes they may change their policies. So this is just a disclaimer. So we will start firstly with the OPRA exam. As most of us know that now KAPS exam is closed. Now Australia has introduced a new exam from March 2025, that is OPRA exam. The full form of OPRA exam is OPRA, Overseas Pharmacist Readiness Assessment. This exam was started in March 2025, and this exam is specially designed for the overseas pharmacist. So they want to assess the knowledge of overseas pharmacists. So before that, there was two exams, paper one and paper two. But now APC, Australian Pharmacy Council, has introduced only one exam, that is this OPRA exam. It is made up of 120 questions. All the questions are multiple choice questions. And along with that, you can give this exam in your home country. Every country has number of options over there where student can go to a center and give their exam. This exam happens three times a year: March, July, and November. And the preparation time for this exam is, I think, 3.5 months difference is there between all the exams. So this is the preparation time for so as to prepare for this type of exams. Exam duration is 2.5 hours, and as I already told you, 120 questions are there. And the fees of this exam is 2190. Most of us know Hindi, so I would like to say 2190 Australian dollars will be the charge for this OPRA exam. And I would also like to say one more thing. Before this before registering yourself for this OPRA exam, we need to go through some journal steps. Like first step is eligibility check. In eligibility check, we need number of documents like our passport, national ID, birth certificate. Along with birth certificate, we also need our state pharmacy council registration. If you don't have state pharmacy council registration, without that also you can apply for OPRA exam. You need to approach your pharmacy council that you are eligible to become a pharmacist. Your council will give you a certificate that this candidate is eligible to become a pharmacist. So you can apply for OPRA exam without state pharmacy council registration as well. This eligibility check process is a paid thing, and 810 is the fees for this thing. For So the procedure begin with eligibility check. You will pay $810 to the Australian Pharmacy Council, and it will take 1 to 2 working days. And your eligibility check means your documents will be evaluated within 1 to 2 working days, and you will be eligible to sit for OPRA exam. So after that, you have sufficient time. You can prepare for your OPRA exam. As I told you, OPRA exam happens 3 times a year: March, July, and November. So as per your convenience, you can book your OPRA exam. And cost, I already told you that 2190 Australian dollars is the fees for this exam. You can appear in this OPRA exam number of times. There is no limitation to sit in this exam. So as I already told you, the eligibility, you need passport, you need national ID, birth certificate. If you don't have birth certificate, apart from birth certificate, you need to produce one more photo document that will work instead of your birth certificate. But now most of the students already have their birth certificate. It must be in English. If the document is not in English, you need to translate it from NAATI, NATI website. You can approach one NATI professional who is a certified person to attest not NATI documents from Hindi to English, from Malayali to English, from any regional language to English. So if you don't want to go for the translation, just go with the other document like driving license, voter ID card, or you can also choose PAN card as well. So after that, eligibility check will be done, and you can book your exam. After passing the OPRA exam, OPRA result will come almost after 20 days. And after passing the OPRA exam, to prove your English score as well. So English proficiency is mandatory so as to appear for OPRA exam, so as to be eligible for further registrations in Australian Pharmacy Council or AFRA, Australian Health Professional Regulation Agency. So PTE is a score. PTE is valid in Australia, but PTE is not valid in other countries like New Zealand, Canada, Ireland. These countries do not recognize PTE exam as a English language exam. So you need to go for IELTS or OET for other countries. But for Australia, most of the people choose PTE exam because this one is much easier as compared to others. So this is the thing which candidates need to do after passing the OPRA exam. And the benefits to appear for Australia, as everyone knows that high demand of for healthcare professionals in Australia, and permanent residency options are also there through the skill migration option. But options are less, but there are chances number of candidates got invite from their home countries and they are settling in Australia on permanent residency visas like 491. And excellent work life balance. I would like to say a few words on this work life balance. In Australia, this work-life balance is very important because is the country likes the people, the way that they live. They also want to be live like means they want that migrants will enjoy their work-life balance as well. So there you need to work only Monday to Friday for only 8 hours per day, and you will be paid huge for that thing. And visa options for Australia, as I told you, skilled nomination visa, that are permanent residency visas. That is 190 visa. This is a best visa, I can say. And other one is 491 visa. This is a regional visa. This is also a permanent residency visa, but here is one clause: you need to spare 3 years. You need to spend 3 years in the regional area of Australia. After spending 3 years in regional area, you can apply for your permanent residency. After that, you can claim your permanent residency. And other option like 482. This is employer sponsored visa. You need to find out a employer for yourself from overseas, and he is going to sponsor you. So this one is option is also there. And other visa option is 407 visa. This is subclass 407 visa. This is a basically training visa. So as you all know, after clearing this OPRA exam, 1,575 hours of internship is mandatory. So 1,005 hours and 75 hours internship is mandatory. So as to do this internship, we can apply 407 visa. but you still need one employer who is going to give you training. You need to find out that employer from overseas, and you need to contact him by a number of options like LinkedIn, and a number of websites are also there from you can apply for the internship position. And the thing which every candidate can adopt so as to make their profile good, better, and best, that is the main difference between these skill nomination visas is your points. Because when if you are having good points, the probability of getting the invite will be higher. Some candidates are not aware of the invite. I would like to say that invite is a term that when state got some allocations, some data that they can invite some people from overseas, qualified and skilled person from the overseas. So they will give invite via a portal. You will come to know about these terms later when you will be in the streamline. So when if candidate got the invite, when a candidate got invite from some country, he will become a permanent resident in 3 years. Maximum candidate who got this visa is 491 visa, and we have number of interviews in on our YouTube channel. The candidates who got this 491 visa. So the basic difference you can create among this is you can improve your English score. The English score for provisional registration is just English proficiency. But if you want to make your chances higher so as you can get invite, you must be having superior English. So superior English points are means ki you will have more than 80 points in every module: listening, speaking, writing, and reading. So as we are talking about OPRA exams, first step is eligibility check, and you will pay 81 Australian dollars for this. And after that, you can book your OPRA exam, and the fees for OPRA exam is 2190 Australian dollars. And there are unlimited chances you can appear number of times for the OPRA exam. But if you joined Elite Expertise, I would like to say one thing. You are going to crack this exam in the first attempt. So believe me, you will not get the chance to appear for the second time. And for the skill assessment outcome letter, now after passing this exam, you need skill assessment outcome letter. You need to pay 300 Australian dollars to the APC, and they will send you the PDF of your skill assessment outcome letter that you have qualified your OPRA exam, and you are now eligible to apply for 190491 visa in retail pharmacist and hospital pharmacist occupation. After that, English language exam is there, and if we go for the PTE option, then I think 15,000 is the average cost of this exam. And if we go for OET exam, occupational English test, the fees for this exam is I think 35,000 rupees. And for pharmacists, OET exam happen 1 month later, means it is going to happen on 3rd of Jan, and after that it will also going to happen in the month of March. I think first Saturday will be there, and after that in the month of May. So after 1 month you can appear for OET exam if you want to go for the physical option. And online options are also there. You can also appear for OET exam as a online option as well. And IELTS, most of us all already know that IELTS is an exam, and you can also appear for IELTS. It's a basically physical test. You need to go to IELTS center where the exam is being conducted, and number of stations are already there where you can appear for this exam. The OPRA exam is also taken by the PTE, Pearson Test of English. The same center is conducting the OPRA exam. And in India, we have number of centers like in New Delhi, Noida, Gurgaon, Chandigarh, and in Punjab, Mumbai, Pune, Hyderabad. We have Chennai. We have number of options in entire India. Wherever be your region, you can go there and book your exam over there. You need to travel much. Not you need not to much travel much for this exam. After that, you have to register yourself in AFRA. AFRA means AHPRE, Australian Health Practitioners Regulation Agency. So, yeah, this is the body who regulates the registrations of entire health professionals, means doctors, nurses, physiotherapists, dental, every health worker is going to be registered themselves with EFRA. So we also need to register here. So the fees, here the fees is mentioned wrong, dear. Fees for the provisional registration is 404 Australian dollars, 404 Australian dollars. And before that, you also need international criminal history check. So you also need to pay, I think, 7 to 8 Indian rupees for the international criminal history check for one country. If you travel to some country and stayed over there for more than 6 months, you also need international criminal history check for that country as well. Sometimes candidates are also there. They went to Dubai and stayed over there for 1 year, 2 year, and they also need international criminal history check for Dubai as well. So, like if you travel to any country and stayed over there for more than 6 months, you need international criminal history check for that country as well. And visa options, I already told you that we have a number of options 407, 482, and skilled migration options as well. That is 190 and 491 visa. Internship, internship 1,505 hours and 1,575 hours is the internship duration. You need to secure an internship and you need to approve it from EFRA before starting it. EFRA will approve within 7 to 10 days. Your internship will be approved by the EFRA. After that, you can commence your internship. After the completion of 75% of your internship, you will be eligible for the next two exams. That is intern written exam and intern oral exam. Intern written exam is basically a exam which is also conducted by the Pearson. You must be in Australia, so you are going to book this exam, and this exam is also happening 3 times a year. You would go to Pearson Center. The benefit of this exam is that you can carry books or study material with you. It's a open book exam. You can refer to any books, any study material, any handmade things, and you can find out the answer over there. You can't take any digital material with you, but oral exam is completely different. It's a basically ABC, three parts are already there. Means you have completed 75 hours of your internship, and now you are going to become a fully registered pharmacist over there in Australia. So you learn number of things about their culture, about their practice, about the ethics guidelines. So you will be treated like a pharmacist. So you need to prove yourself in number of things. So after that intern and oral exam, you will become a complete registered pharmacist in Australia. So this is all about the Australia. And I would like to take questions in last about Australia. If you have some question, you can write down it to yourself, and you can also mention the comments in the chat box. We will take the questions later. For New Zealand, for New Zealand, OPRA exam is the same exam which is also for Australia and New Zealand. And the same body, Australian Pharmacy Council, is going to conduct this exam for both countries, Australia and New Zealand. But the difference in Australia and New Zealand is that the eligibility check criteria is different for both countries. First main difference is Australia accept number of English exams like IELTS, OET, PTE, but New Zealand accept only 2 to 3 exams. New Zealand accept only IELTS and OET. New Zealand accept only IELTS and OET. I think there is also some mistake. So New Zealand accept only two exams, IELTS and OET. OET is occupational English test. It's a practical exam. Means if you are a pharmacist, you need to behave like a pharmacist in 4 modules of exam: English, writing, reading, and listening. You need to behave like a pharmacist. There will be questions related to our profession. We need to face doctors, we need to face patient, we need to face our colleagues, nurses. So all the questions will be like that. You need to behave like a pharmacist, and uh, it's like a OSCE exam. I will let you know later about the OSCE exam. So full form of this exam is same for Australia and New Zealand, and the fees for the exam is also same, 12190. But the criteria so as to apply for the eligibility check is completely different. You must have English proficiency before applying, before sitting in the exam, and you must be having 1 year of experience before applying for the document evaluation. So you need English exam first, and also along with you must have 1 year of experience in your occupation in your home country. After that, you will be eligible to sit for the OPRA exam if you are going to apply for New Zealand. And there are only two chances to sit for OPRA exam if you are going to sit for New Zealand. So you can also get third chance to apply to sit in the OPRA exam for New Zealand, but it is completely based on the request you are going to make to the New Zealand Pharmacy Council. They may grant you the third chance or they may not grant you the third chance. It's up to them. So career benefits. New Zealand is the one of the cleanest and mm, health determined country. Higher, there are good demand in for healthcare workers, and the migration process is also little bit easy as compared to Australia. You will get, if you try hard, you will definitely get some employer over there who is going to sponsor you in the entire process from your home country to New Zealand. So the chances of getting the sponsorship is higher for the New Zealand. And definitely my parental registrations are also there for New Zealand as well. And there is also good work-life balance. In India, if a pharmacist is working over there and running his or her shop, so he need to give, I think, 11 to 12 hours to the pharmacy. Then he will be able to earn bread and butter for their family. But in Australia, if you work only for 8 hours, you will have enough funds to enjoy your life and enjoy your family time, and everything is there. So these countries are very good and excellent work-life balance is over there. So, but average salary is little bit same as compared to Australia. They both have $85,000 per year is the salary, and for experienced pharmacist 1 lakh per year is the salary for New Zealand. Australia and New Zealand both are having almost same salary scale, same salary scale. So the procedure, how to start the procedure of New Zealand. As I told you, the document evaluation skill assessment process is little bit different from Australia. You need to arrange all the documents, and after with 1 year of experience, then you will apply for the eligibility check. Then they will, and the time taken by the New Zealand is much higher as compared to Australia. Australia give uh, eligibility check within 24 hours, but New Zealand may take 3 to 4 weeks time so as to evaluate, as to give the result of document evaluation. After that, same you can sit for OPRA exam, but you will have again two chances only. After successful completion of OPRA exam, you need to go for NZPL course. This is a legislation course, entire rule and regulation regarding to Drug Act, what pharmacy rules and regulations are over there. You will need to join this course. And Auckland University is there, which is conducting this course on an online mode. And after going to this course is happening 2 times a year. You can join this course in March and in August, and it will end up in, I think, 3 months. For 12, in the 12th week they are going to take a exam for you, and almost every candidate pass this NZPL course, and then you will be eligible to start your internship. If you are in Australia, sorry, if you are in New Zealand, you can find out your internship and start your internship after passing this NZPL course. But if you are in overseas, you will be eligible to apply for internship program. Before NZPL course, no one is going to give you the sponsorship. So NZPL course is important for New Zealand. And the fees for NZPL course is 2,400 New Zealand dollars. And the fees for start the internship is 12,000 New Zealand dollars. Sometimes employers of New Zealand who are going to give you the internship, they are going to pay this 12,000 New Zealand dollars on behalf of you. But it may vary. It's up to your employer. Either they are paying this fees on behalf of you or not. It's up to them. Next country is PSI, that is Ireland. PSI exam is over there. So full form of PSI is Pharmaceutical Society of Ireland. And there is also two ways. If we are Indians, definitely we need to go through the path one. Path A is for those countries, those are recognized by the Ireland. Our Indian countries, Australian, Asian countries are not recognized with the Pharmaceutical Society of Ireland. So from these two ways, we need to go for second one. So the ways are, firstly, we will apply after application, after I think 2 to 3 months, they will make us eligible to go for the further process. They may reject our application that we are eligible or not. It's completely up to the PSI. After that, we need to go through the holistic assessment. And if we are from the any Western country, we did our pharmacy from Western country, we will came under path A. And as we are Asians, so they do not recognize our universities, so we came under path B. Then after that, examination process is there, which I am going to tell you in the coming slides. So, so the pattern of the this PSI exam is, firstly you need to give a written exam, that is a MCQ based exam, and you can give this exam in your home country, from which any country you belong to, you can give this exam in that country. And for the OSCE exam, this objective structured exam. For this exam, you need to move to Ireland. You need to go to Ireland, and there are 2 to 3 visa options are there. By going through that, you will reach Ireland, and you will appear for OSCE exam. OSCE exam is completely a practical based exam. You must have sufficient knowledge so as to appear for this exam. You need to behave like a pharmacist, complete pharmacist, and there are 10 to 12 stations over there. And you will give 5 to 7 minutes, 5 to 10 minutes over there, and you will be given a task. As a pharmacist, you are going to uh, give your comments. You behave like a pharmacist over there, and after that station, if you pass all the stations, then you will become a registered pharmacist in Ireland. If you pass any of the station, you will appear again in the entire process, and you are going to give again OSCE exam again. And the requirements, the eligibility, you must have degree in pharmacy. And at the time of final registration, after passing the OSCE exam, you need IELTS or OET exam as a proof of your English proficiency. So at that stage also, you must have B grade OET, or with proficient score IELTS, means 7 band in each module of IELTS. And after that, if you really want to go for PSI exam, then it's the best option for every candidate who is Indian, Pakistani, Nepali, and Sri Lankan, because nowadays Ireland has reduced the criteria to become a pharmacist in Ireland. Before that, the criteria was higher, but nowadays they reduce the criteria. Before that, only Form D students were eligible to sit in the exam, but now B Pharma candidate can also apply for PSI exam. So there are lots of opportunities over there, and everyone knows that Ireland is a good country and European country, of course, and they really have good work-life balance, and you will get too much as compared to Australia and New Zealand. But the tax structure is different in every country. So after deduction of tax, you will earn in all the countries apart from Canada and USA. You will get higher pays in those countries. So these are the visa types, that is Journal Employment Permit, Stamp 1G Graduate Visa, and Critical Skill Employment Permit. So once you pass this written exam, MCQ exam from your home country, you can apply for these exams. And the fees for these visas is also very less, and the chances probability of grant of visa is extremely high. So if you really want to move to Ireland and work there as a pharmacy, you need to take few exams. That is, initially you need to go for the initial review exam. then in this that is eligibility check, they are going to approve your document. They are going to watch your documents, your state pharmacy council registration, CPDs, continue professional developments. Is that program is running by your council or not? Are you attending these webinars or not? Are you updating yourself or not? What was the syllabus you learned during your academics? They also they this is also the one of the requirement. Your university is going to send your transcript, degree certificate, and along with the syllabus which you teach, which you gained education during your academics. So apart from that, you are also going to send good standing certificate from your state pharmacy council. And there are four forms: TCQR1, TCQR2, TCQR3, and TCQR4. These are four forms. You need to fill all these four forms and apply for that. And the fees, so as to make the first application, that is initial review, is 500 euros. It's almost I think dollar Ireland dollar is, I think, more than 100 rupees. So it's I think nearby 50 60,000 rupees will be there for the initial review. And if you present your application in a good manner, definitely you will become eligible to sit for the MCQ exam and OSCE exam for PSI. So if you become eligible, then you can apply for the MCQ exam, multiple choice question exam, and you can pass this exam in your home country. After that, you need to go to Ireland so as to appear for the OSCE exam. Certification and registration is mandatory, means you must have your certificate from, you must be registered in your home state, in your state pharmacy council. Like I am from Haryana State Pharmacy Council, someone from Punjab State Pharmacy Council, Hyderabad, Telangana Pharmacy Council, and Kerala State Pharmacy Council. You must be registered in your home state pharmacy council. That is the minimum eligibility, and you must have 4 years of degree in pharmacy. Apart from that, you must have a internship program, that a certificate of that program that you attended during your academics. That is something like hospital training, which is a part of curriculum of B Pharma nowadays. PCI made a curriculum that every candidate need to do a hospital training for, I think, 30 days. So I think who are recent graduates, they must have did this internship or over there during their academic time. So they need a certificate of that internship as well. When did you started, and when did you finished, and what you learned during this particular training. And English proficiency test is required at the time of final registration as a pharmacist. After passing the OSCE exam, you need to have your English proficiency test with you. So the fees for holistic assessment is 1,000 euro, means 1,000 euro is the fees for holistic assessment. If you become eligible for the for if you become eligible for sitting in the MCQ exam, then you need to pay 1,000 euros. And after that, for the aptitude test, that is the OSCE exam, you need to pay 3,000 euros. And after that, I think there is no fees after that. And you, after paying 4,500 euros, you can become a registered pharmacist in Ireland. So after that, the name is Canada, and the exam name is PEBC exam, the Pharmacy Examining Board of Canada. This is, I think, I would like to say, one of the most difficult exam in the history of licensing exams. So this exam is a part of Canada, and in Canada there are different number of provinces. So after qualifying this PEBC exam, you need to register yourself in different provinces. So there are some more things over there. If you are going to change your province, if you got some over opportunity in some other province, so you need to do some more formalities over there. And there are two things. First one is qualifying exam and evaluating exam, and after that you need to pass qualifying exam. And these initially you need to face MCQ exam, and after that OSCE exam is there. So the fees for this where is the fees for this? Yes, in next slide, fees is on next slide. And the salary is 90,000 to 110,000 dollars per year. So Canada is offering excellent salary to the pharmacist, and there is a huge demand of pharmacists. But the basic challenge is that student don't want to go for this difficult test. But I will make you assure that if you prepare your PEBC exam with elite expertise, definitely you have the confidence to pass this exam in the first attempt. So if we go for the eligibility, you must have a degree, 4-year degree in pharmacy from a recognized institute, and English is also the same requirement. You must be have the English proficiency, that is IELTS, and uh, OET I think is also there, but TOEFL is also there, CELPIP is also there. Number of other than PTE, I think all the major options are accepted by the PEBC. So you must have the document evaluation approval, that you are, that is the initial step for all the countries. Your documents must be approved, your evaluation must be positive so as to appear for these type of exams. Career benefits are excellent. High pharmacist demand across all the provinces of Canada. Even few of my classmates, my batchmates in B Pharma are also there in Canada, and they used to say me that if you have someone who qualified the PEBC exam, my company can sponsor him. If you have any candidate who passed this exam, our company is can sponsor. So there are great options over there, and number of vacancies are also there in Canada. So if you can say pharmacist is in a critical shortage skill over there, this is the good time to apply for PEBC exam as well. And visa type, there is express entry visa also there, skilled worker program is also there, and provincial nominee program PNP is also there, work permit via employer sponsorship options is also there. And if you qualified your PEBC exam, definitely you will get some sponsorship over there. And your employer, if you get the good employer, your employer can pay entire fees starting from the evaluation. Then after that qualifying exam, all the fees can be paid by your employer if you get the sponsorship from a good employer. So these chances are also there. So you must have the guts to pass this exam. Rest, you may get good sponsor over there who can bear all these expenses on behalf of you. But before that, you need to have all these exams cleared. So after that, in this also, part 1 MCQ exam and part 2 is OSCE exam, objective structured clinical examination. This is at this time, at the time of OSCE exam, you became a complete pharmacist. You need to behave like a pharmacist. This is the final and last and most crucial part to become a registered pharmacist in Canada. As I already described you, English proficiency is mandatory. And after passing this MCQ and OSCE exam, you need to register yourself as a provisional registration with PEBC. And after that, apply for PRA and do your complete your internship and final assessment, that is OSCE exam. Then these jurisprudence exam, like that, these are depending upon the province to province. You need to pass these exams as per the as per the province. They may be different for every province because their health guidelines and health criteria is different in and almost in all provinces. After that, you will get your journal registration as a pharmacist. And when it comes to UAE, one of my colleague, Kripa is there, who is a practical example and who can let you know about the process of DHA, MOH, HAAD HAD exam. So these all the exams are for the Gulf countries. If you want to apply for Dubai, DHA exam is sufficient. And if you want to apply for other countries other than Dubai, like Abu Dhabi, then you can go for MOH exam and HAAD exam. Kripa, are you there?
Hi Rakesh.
So she is Kripa, and she is going to let you know something about these Gulf countries licensing exams.
Hi Rakesh, thank you for giving
I
me this opportunity. Am I audible? Hello?
Yes, you are audible. Yes, you are audible.
Yeah, so a person or a candidate who is trying to go to Dubai, that is UAE specifically, majorly you will be having three sort of exams. So if you want to work only particularly in Dubai, you have to write the DHA exam that is conducted by the Dubai Health Authority. And if you want to work in other Emirates like Sharjah, Ajman, Fujairah, Ras Al Khaimah, and Al Al Quwain, that is the other five Emirates of UAE, then you have to write the exam of MOH, that is Ministry of Health. And if you want to work particularly in Abu Dhabi, the exam is hard, but the name they have recently changed. Now it is DOH, that is Department of Health. It is conducted by the Abu Dhabi government. So these are the specification of the exams that you have to write for particular, like province. It's not province for the particular country. It's like an emirate, like an island. So there are around seven Emirates. For Dubai, one exam. Hard exam is for Abu Dhabi, and for the rest of the five islands, it is MOH. So the basic eligibility for all these three exams is you need a BPharm, you need at least the Bachelor of Degree with you. You can be having BPharm, MPharm, or PharmD. For DPharm, who done the diploma, unfortunately they can't write the exam, but they can write the exam for pharmacy technician in Dubai. There is another exam that is pharmacy technician exam, which they can appear for, which is only for diploma people. It's not for the bachelor people, it's for the diploma people. And those who are working for 2 years, there should be a working experience of 2 years without any gap. Okay, there should not be any gap. There should be 2 years of experience that is required to show for the exam. So these two are very mandatory. So obviously you will become a licensed pharmacist in your home country because without getting the license, you will not anyway have the experience of 2 years. No. So the license is mandatory. 2 years of work experience is mandatory, and at least you should have a bachelor's degree with you. So a candidate who are having all these criteria can directly apply for data flow. That is the verification process, like how we have for the OPRA. These three authorities will do the like check. They will check our documents. They will do our skills assessment. That is the name of the process is known as data flow. So once you get a positive result from the data flow, it will take around maximum it is 1 month. If the documents are very clear, it will barely take 2 weeks or something like that because things in Dubai is very fast and everything is online. So if your documents are proper and if you are submitting correct documents without any name mistake, date mistake, it will be very soon. Like within 2 weeks, you will get your data flow done. After that, you can book your exam. Either any one of the exam you can book, and you can appear the like you can write the exam. It the amount of the exam, the price or the fee of the exam is differing for all these three exams. It's not same and same as the data flow also. Data flow also it will differ. It is not the same fees for all these three because three authorities will do the data flow separately for the candidates who are writing the particular exam. And career benefits compared to the Western countries, the best one will be safety and the other one will be the tax-free income. Whatever you are earning, you will completely earn. There will not be any tax or any cutting, and insurance will be completely free. It will be depending on your employer, and you don't have to do any sort of what we say the registration process. Because once you write the exam and you will get the eligibility letter from the authority, your part is done. The rest of the things your employer has to do. Like you have to find a job, and if you get a job, the employer will do all your things like visa process, registration process, and maybe getting a insurance. Everything is done from the employer itself. We don't have to do anything, and we don't have to pay anything also to employer. It is the employer's responsibility to make your registration or your license active in the country. So your part is just passing the exam and finding an employer and cracking the interview and get a job. So other benefits of Dubai, of course, will be there is a like the working environment is similar to our India. Most of the people who are working with us will be Indians only. Most of them, like 80% will be Indians. Rest will be from majorly. I'm saying about the pharmacy because the healthcare people majorly they will be working from India, or you can find some Pakistanis, or it will be like these countries. Hindi, if you know Hindi, you will be able to communicate well. And those who know the Arabic language, it is an add-on. Like the people who are who knows at least to speak the Arabic language, they can get jobs in hospitals very easily. And there is only one type of visa, like your employer have to sponsor. You will not get any permanent residency or nothing. Not other type of visas are there. Other visa which you can consider is visiting visa. You can go with your visiting visa, find a job, and convert that to the employment visa. And the employment visa will be for 2 years. Every 2 years, your employer can or your employer will renew the visa. It's their job. We don't have to do anything on that. It's simple as that. If we want to resign, we can resign. If they don't want to keep the candidate, they can revive us. That's all. Other than that, every 2 years the visa will be renewed. This much only there to tell about the Dubai exams, and it is an MCQ exam. Comparatively, now the difficulty level of these exams have also increased because of the competition. Before it was a small, like a normal exam, which we can easily learn by hearting some MCQs or by having a few classes or online something like that. But now they have drastically increased the level of or the difficulty of DHA exam and the hard exam especially. MOH is still a little bit easy compared to other two exams, but the DHA and hard exam have increased their quality and the difficulty level. It is somewhere similar to the KAPS exam of Australia now because there is huge competition. So whoever is writing is passing. So the eligible or the proper candidates or the qualified candidates, they are not getting the job or the salary that they should expect or deserve. So what they are doing, they have increased the difficulty of the exam and it made the filtration easy. So those who are actually knowing the knowledge only able to crack these exams. So that's why a proper like training or learning under a professional people are very important. And as Rakesh Bhai already mentioned, we have trainers from Australia who are working clinical pharmacists. All your classes will be taken from them. There will be recordings for each class. You can, if you are working, if you are studying, if you are a student, it doesn't matter because as Ashutosh mentioned, primarily I was a student over here. When I wrote CAPS, my baby was very small and I was working full time. So if a mother can do, and I feel anyone can do. So it's not that a big deal. It's just it's your choice which country you have to choose and which pathway you have to choose is the it's in your hand because we can't force anyone or we can't suggest because it depend upon your life situation or where you are standing, what is your experience, how much money you can spend on this, or how much patiently you can wait for the visa. That is the major thing. If you want a financial like financial stability soon and you need a good opportunity also, then Dubai will be the best thing. And if you're in your 30s and you have some sort of experience and you need a permanent residency or permanent settlement, then you can consider the other countries like New Zealand, Australia, or Canada. And if you're a single person, not married, and you can travel, there is no restrictions like that, then you can, of course, plan for Ireland because primarily the major issue that we are feeling or if that candidates feel for Ireland is they are not like we can't take our spouse or our partner together when we are moving first. At least 6 to 7 months, there will be a gap. So, those kind of people who are ready to be apart from the family and it is not an issue, they can consider the Ireland. Other people who need a permanent settlement with their country, then they should definitely choose Australia, New Zealand, and Canada. Canada, as Rakesh Bhai mentioned, it's the one of the country who pays very well and who will take care. As I mentioned for Dubai, they will take care of all your expenses. But it's just the exam is little bit difficult. So this much only about the DHA and other exams. Now I think Rakesh Bhai will mention about Elite more.
Thank you, Kripa. If you have questions, you can ask by turn on your microphone, or you can ask in chat books as well. One question is there in chat box. I am 8 years private hospital experience, hospital pharmacist jobs. Dear, you have a good experience and you are a good candidate. If your qualification is Bachelor of Pharmacy, you can apply for Australia as well. You will get higher points for your experience. So the probability of getting the invite in Australia will be higher for your profile. You must have English proficiency. So the best country for you, according to me, will be Australia. And if you want to go for second other country will be Ireland. That is PSI exam. Nowadays, they have number of options over there in terms of vacancies, and it's very easy to reach over there. Next question is, do we need prior working experience in India to appear for OPRA? So my colleague Aishwarya already replied you, no experience is required for particularly Australia, but New Zealand require 1 year experience as a pharmacist in our home country. So, Mr. Anil Kumar, you mentioned that your qualification is diploma in pharmacy. So, you are not eligible for the OPRA exam. You can go through VETA assesses and have a skill assessment from them. Then you will be eligible for the pharmacy technician occupation. It's a good option for you. You pharmacy technicians are also in the skill migration list. So, you can apply your permanent residency from here. Maybe you get invite from the Australia, and you can also apply for some sponsorship positions as well. If you just finished pharmacist, can you apply for work directly without experience? Yes, for Australia you can apply with zero experience as well. Sir, someone told me that if we passed in OPRA exam, it contained barrier to find a internship in Australia. Yes, dear, you are somewhat right at this position, but it's not no. It's not like you can't get internship while you are overseas. There are other options as well. If you are a pharmacist and you are really trying hard every day, you are trying for the internship position, definitely one day you will get internship. If you are just waiting for the invite from the state that you will get direct permanent residency from India, then the probability at lesser point are low. But if you have good points, then the probability of getting invite is also high, and getting and securing the internship also. How much how many years experience is required before attempting PEBC? PEBC experience is not required. Experience is not required for PEBC as well. I have 3 years experience as medical, I think subscribe and medical subscribe. S- Will it be considered as a experience? No, it will not be considered as a experience. You must have experience in your profession. That is, as a pharmacist, experience will only be considered. One more question is also there. Hello, if I have a family, once I pass my OPRA exam, can I go with my family when going to do internship in Australia? And do I wait for after 2 to 3 years? You can apply 190 491 visa, 407 visa, 482 visa. With all these options, you can bring your family with you. For the 482 visa, it's up to your employer. Either your employer is sponsoring your family or not. But in case of 407 visa, you you need to show some funds over there, that you have enough balance in your account that you can manage your family over there. Because in during internship you will not get any other working rights. Your partner will get working rights, full working rights, but you will not get extra working rights. You can do only your internship. So you must show some funds so as to bring your family with you. One question is from Mohammad Azhan. I have 8 years experience. I have 8 years hospital pharmacist experience in Pakistan with IELTS academic band 6.5. In which country I should apply? If Australia, kind revise the fee structure and criteria to apply there, as I just joined after Ireland details. My dear friend, you have good experience, and you already have your English score. So I would like to say apply for Ireland, because if you apply for Ireland at the end of next year, you will be in Ireland. Means within 9 months you will be in Ireland. They are going to conduct their next exam in September 2026. Before that, your documents will be evaluated by them, and you can prepare your exam, and you can pass this exam, and you will be appear for the OSCE exam in September 2026. And there is no internship over there if you apply for Ireland. So in other countries there is internship over there for 1575 hours, 1 year internship and something like that. But for Ireland, if you pass the OSCE exam, you will become a complete registered pharmacist, and you will start getting the pay like a full pharmacist. So Ireland is a best option according to me, but rest it's up to you. If you have some sponsorship option over there in Australia, then you can apply for Australia as well. Uh, I am fifth of Form D, can apply for exam. If you are in fifth year of Form D, if your university is ready to give you graduation certificate, uh, I I heard before that if you are doing your Form D after 4 years, you can apply for degree certificate from your university. You will be apply for the position. You will be eligible for applications to apply for the graduate. Means here in India, graduation is 4 years. If your university is giving you a degree certificate that you already completed 4 years of your Form D, then you may be eligible. If your university is not agree to give you these things, then you need to complete your Form D first. After that, you will be eligible. Is there any proper institute to prepare myself for Ireland exam so that I can give test in September 2026? Yes, dear. Elite Expertise is the institute where you can prepare. And we have Irish pharmacist with us. Her name is Rifga Mohammed, and she is a Irish pharmacist. She is basically from Sudan, and uh, she trained overseas pharmacist so as to pass their MCQ and OSCE exam. And a number of students are also with us who are preparing for PSI exam. So you can prepare with us for this Ireland country, and you can definitely pass MCQ and OSCE exam in the September 2026 intake. It's the right time to join the course, because recently we have started the fresh batch for PSI exam. So you will get the recordings of previous lectures, and you can patch up with all the students, and you can appear in September 2026. How many attempts can one appear in PEBC exam, or advice if there is no limit? I think Kripa, I exactly don't know the answer of this question. How many attempts are there for PEBC exam? Kripa, are you there?
Hello.
Yes, Kripa. Kripa, Minahil is asking about one question. How many attempts can one appear in PEBC exam? Please advise. Is there any
I
limit
think
or
there
not?
is no limit for appearing currently, Rakesh bhai. They can appear as a number of times. There, it's similar to OPRA, like OPRA in Australia. There is no particular limits, I guess.
Okay. And but for the OSCE exam of New Zealand, we will get only three chances. That is
Yeah, for
two.
even for OPRA
Yes,
exam in New Zealand, they have only two attempts to
two
appear.
chances, two attempts, only two attempts.
Yeah, two
Yes,
chances only. Yeah, and it is only valid for 2 years too.
yes, yes, yes. If you have any questions, you can unmute yourself and ask. I am familiar to answer your question Hindi as well. If someone is there who can ask question in Hindi, I will हिंदी में आंसर देने में भी कोई दिक्कत नहीं है. Is Elite providing online training sessions? If yes, need details of timings and fee structure. Dear, our team will contact you regarding the fee structure. Aishwarya, can you please reply her regarding the fee structure and the class timings as well? If I yes, 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 dear.
Actually, say suppose we have 90 points UI. So, which is the
Okay.
best state which nominates pharmacists? Say suppose South Australia needs 3 years of experience, isn't it?
Yes, yes, yes.
But Victoria doesn't specify. It usually gives the invited 75 to 80 points. So that which are the preferred states for hospital and retail pharmacists?
You can apply in any state. Even I would like to say you must apply in all the states. And if you are having 90 points, then your profile is a good profile. And I would like to say one more thing. If you can improve your points by number 5,
Yes,
if you
by
done
NATI.
by Nati, yes, definitely the probability of getting the invite with Nati will be higher, much higher with 95 points. And which is 90 points are also good point, but on 95 points the chances of getting invite will be much higher as compared to
And also, will it
90.
be quicker?
Yes, Nati exam happens every you can book a NATI exam even after 5 to 7 days. So it's up to you. You can book a NATI exam as per your convenience. And the preparation time for NATI, if you prepare for NATI exam dedicatedly, I think 30 to 35 days are enough to prepare for the. You will be you will be familiar with the exam structure because for NATI exam you can't prepare for NATI exam. You must be having enough knowledge for that, and with that knowledge definitely you can clear this NATI exam in the coming first attempt. There are number of online platforms are there which are free, and by using that platforms you can clear your NATI exam in the first attempt. So I would like
And
to say, if you already cleared your KAPS or OPRA exam and you are really hoping for the invite, then do Nati. And if your spouse is also skilled or not
no, no, actually, I'm not married. I'm single,
single,
and
you are
I'm
getting 10
also
points. Okay.
And I'm also thinking of, after getting the general registration of pharmacist, I do think it
Okay.
is better to improve our qualification because as you have done formed, it is better to go for clinical pharmacist, consultant pharmacist roles. So will that be easy?
After becoming a registered pharmacist in Australia, you're talking about Australia, right?
Yes, yes, Australia, obviously.
Yeah, yes. So when you reached over there and become a registered pharmacist, you can, if you want to be a specialized pharmacist over there, then you need to work in that segment in particular thing. Then at that stage, your qualification will not matter. At the
Okay.
stage, the thing matter is only your exposure, that you are learning number of things with that department. And after that, when you are going to claim that you have expertise in particular department, then you will get the specialization in particular department. Because for that thing, course is not enough. Means you
Yeah.
are going to improve your qualification or something like that. Qualification is not needed at that point of time. You need to improve, you need to work over there. Number of pharmacists are also there. They work in community pharmacy and work there for a long time, and they are not getting the time to work in. They are not getting the chance to work in hospital. So by working in a hospital, you will get the chances to become a specialized person.
Yes. Lastly, while launching this registration of interest, whether retail pharmacists should be given preference to or hospital pharmacists should be given preference to.
Dear, this is a tricky question, and I would like to say in 2025, number of candidates got invite in hospital pharmacist even on 65 points. So I would like to say it was luck and number of candidates who are having 95 points and they don't get the invite in 2025. So it's totally depend upon the scenario. Last year, means last financial year, they they invited hospital pharmacist, but before that, Victoria never gave invites to the hospital pharmacist candidates. They usually prefer retail pharmacist, and both the occupations are same. Retail and hospital is same, but in case of ROI in 2025, February 2025, number of students got invite in hospital pharmacist. I don't know what will be the answer of your question, but it's up to you, dear. Both
Yes.
the occupations have equal probability to get the invite.
Yeah. Thank you for answering the questions.
Thank you. Any other question? Do you have any question in chat box? Could you tell any material available for OPRA exams? Ramesh, is it's a good question and practical question. Everybody want to prepare for the OPRA exam, but I would like to say one thing with very confidence. If you want to appear for the OPRA exam, you need dedicated guideline that what is important, what is not important. You need to be focused over there. We have n number of syllabus in pharmacy. We learn number of things during our graduation, during our masters, but OPRA is having a particular frame, and elite expertise is having that frame with them. What type of questions they are asking, what topics are important. If you prepare by yourself, it may take up to 1 year, but if you prepare with the experts like Arif sir and Harika ma'am, definitely within 3.5 months you will be go through the entire process and you will pass your exam within 3.5 months. If you really want to get some, if you really asking some study material, and you can open our chat box, you can open our YouTube channel. There are number of free lectures available over there, and every week we used to post MCQ questions in our in social media channels like on YouTube and Instagram, and on that platform as well you can apply, you can see the kind of questions what OPRA, what the APC is asking in these licensing exams. So it's better to have a good concept of your graduation, and they, because in KAPS it was not so difficult, but OPRA exam is little bit tricky and they are asking number of questions from the therapeutics part. So you must be having excellent knowledge regarding the mechanism of action. What is the mechanism of action of drug? I think every candidate got 5 to 7 questions on mechanism of action, and apart from that, inhibitors, inducers, their role, and their classification. Number of drugs come under inducers and inhibitors. Every many and number of things are all also there. You just improve your concept, try to memorize number of mnemonics so that you can pass this exam in the coming first attempt. And if you really want to do it, 1 year is too long time. If you prepare by yourself, get the specialized guidance and pass this exam in the first attempt. Do we have any other questions, or we can wind up the session? I don't think so. There are much questions. So I would like to thank everyone who spared time and joined this webinar. And I hope I was capable of giving little or much information to you. And definitely, if you have any other questions, you are already in a WhatsApp group. You can ask over there. And if you are looking for some free demo lectures, they are also there. If you are willing to attend any live lecture, which our educator is giving to the entire class, you can contact our team. We can give you the exposure of one to two free lectures that you will come to know about the teaching style of our mentors, so that you will have the enough confidence that you can crack these licensing exams. And if
Excuse
you are,
me.
yes, yes,
Sorry,
Neha.
sir. Sorry for disturbing. I was about to ask a doubt, but my mic was not working. Okay, so my doubt was if I join, means up to what extent will your elite expertise help in becoming pharmacist in Australia? Like up to passing the exam, or if with other like, means document verification and then requiring means what are the steps in Australia to require the position? Up to that, it will help. Up to what extent will I get help from this?
In elite expertise, you will get assistance up to when you become a complete registered pharmacist in Australia. But as I already told you, elite expertise is a teaching institution. We are not migration agent, but we give guidance pathways to our candidates that what steps they can follow to reach Australia. And every month, number of students are migrating to Australia, and we are also conducting interviews for them. And you can watch these interviews on our YouTube channel. And if we say from starting, eligibility check, that is the first step for the OPRA exam. You need to go through the eligibility check. After that OPRA exam, we will give you the assistance for OPRA exam as well. Firstly, eligibility check. Second one is OPRA exam preparation. Third one is PTE exam. We are also giving assistance for PTE exam. And fourth one is AFRA registration. AHPRA, Australian Health Professionals Regulation Agency, Practitioners Regulation Agency. AFRA. We are also giving assistance with AFRA. And the fifth one is the migration process. The number of options we are getting from our who just became a registered pharmacist in Australia. They are giving us the leads that this pharmacy is looking for intern, and they need intern from overseas. They are happy to sponsor the candidate. So we have a list of all the alumni students with us. We drop that message in the group, and whoever fulfill the requirement of employer, definitely they will have interview with them, and who those candidate will be selected, and the migration process will be started from the employer hand for them. So we
Okay,
do help,
sir.
but it's not for it's not so in number, but we assist our candidates. And definitely interview task is someone very personal. If we refer 15 students, 15 candidates to one employer, he will get a huge variety of candidates. And after that he will go he everyone underwent with interview, and who will pass the interview will definitely be there in couple of months.
Thank you, sir. Thank you so much.
Do we have any other questions? If you have any questions, you can drop in chat box, or you can we all are in a WhatsApp group. You can drop your message in WhatsApp group as well. So I think uh, it's time to wind up. So I would like to thank everyone who spared your time to attend this webinar. And Ashutosh, do you have something to showcase over there? And I would like to say one more thing. Please subscribe our YouTube channel. You will get to know number of things regarding your professional growth for overseas. So number of times we used to post number of things over there. Definitely it will improve your learnings. It will improve your knowledge as well as migration steps, updations. We used to make number of videos over there. All the videos are related to our profession.
Yes, Rakesh. And if you guys have any query, you can always connect with our admin team. The numbers are flashing on the group chat. You can take that from there. And also, you are a part of a WhatsApp group. You can drop your queries there and connect with our admins for further queries. Thank you all for joining. Thank you so much.
Thank you, everyone. Thank you.